Morning, Bruce. How are you?
Morning, Matt. I'm very good. Very nice to meet you.
You must have, we've all had a very peculiar year, but I bet your year has been more peculiar than most. How's it been for you and your team?
Well, yes, that's a big question, isn't it? It has been peculiar in all kinds of ways, and equally, you know, positive ways and challenging ways. And I don't know if you are aware, but this is my last year. I'm very shortly retiring. So this year I was going to go down to 4 days and think about the future and plan for the future. And of course, as it is, I suppose it's probably been one of the most intense years of my career. It's all been taken up by COVID. I'm trying to manage other public health programs at the same time, but really it's been 94% COVID. So how has it been? Well, I think for the team, it's been a big ask on top of all of the things that we normally try to do, and we've tried to keep continuing to provide a lot of support and advice and policy and implementation and planning around COVID as well. And like you and everyone else, we've had to do all this from our bedrooms instead of our normal environment. So that's been difficult. And then some of my team have young children and they've had to homeschool and all of that. But at the same time, I think we'll look back on the year as a year of some pride, and just because of the nature of the crisis, we have been, I suppose, rather in the centre of activities. We always try to influence activities across the council, but I guess in the past, you know, we've been in our place, and now we've more prominent, more demand, and I think we will feel good about that. We've met a lot of people's expectations. People have really stepped up in my team, both in you know, large and small ways, and so yeah, very challenging year. I think very rewarding year, although I just hesitate to say that because I know some people have really struggled as well with particularly with the home circumstances. So I don't want to also say that it's been a load of fun. It hasn't. It's been stressful and difficult, but at the same time, you know, we'll look back on it, I think, as we played you know, everyone in the council stepped up actually, but we played a real role in that too as the public health team. So I guess that's a bit of a rounded answer to your question, if I can give one.
I mean, it is exactly a year, isn't it, since the first Boris stay home broadcast. And if we'd known this time last year what we know now, how different it would be. I think we all lacked crystal balls at the time, but fascinated by what you say about it's been a common theme with everyone I've spoken with. It's been the things that we didn't think we would be able to do or would take too much planning, for us all to work from home, as an example, because we had to actually incredibly quickly. We will change the way that we worked, and as you say, you of all teams, right in the middle of all this. What are the things you think you've done this year that even in a non-pandemic year you might continue to do, that you think you've learned from and is actually quite good?
Yeah, I think a good example, and it's not necessarily even my team, it's a bigger thing, but the way the Communities Hub worked, and the third sector and community services with Virgin Care leading that, and to some extent our team as well, and volunteers created a sort of one-stop triage that integrated, that brought together a lot of different services: physical, mental health, food, problems of food, and other things, social care support. So I think that accelerated something that we were trying to do. We always say we want to be one-stop, integrated, seamless around the patient or the client. I think that was a really nice example of where that stepped up. That's something we wanted to do already. I guess the answer that everyone will have given to some extent is, well, okay, we can work more from home, we can work more remotely. I think that is true. I think there has been a price, and I think some people have struggled with this remote working. I think we all have to some extent. I guess we've discovered that the margins of its functionality are far beyond, you know, well, my children probably would have done this already, but, you know, dinosaurs like me, you know, I would have hardly said I could have a proper talk with you, and now I chair meetings of 20 people on Zoom, and it kind of works. I think we will want to get back to something. So that's good. I think in a very large public health way, it's thrown a huge spotlight on two things. The most important for me is inequalities, how people's experience of COVID has very directly, if your experience of the world at large was a struggle before this has magnified it. And if your experience was, generally good, many people have done okay who had the resources to sort of cushion themselves and being able to do jobs from home. It's a privilege, isn't it, that we can do our job from home. Not everyone can. So I think we've always tried to express the importance of and the ethical importance of health inequalities as a symbol of, as an outcome and a symbol of social inequalities. And I think this has thrown a big spotlight on that. It's also unfortunately thrown a big spotlight on the fact that, our whole broad system has struggled with the pandemic in Britain, and there'll be a lot of reckoning about what does that say about our public services, what does that say about or many things about British society and system. So that there's lots of things really mixed into that answer, aren't there?
There are
broad answer.
Yes, it is a broad answer, and it's a very, very well said and good answer, because I think that's the and you're right, it's very difficult not to sort of say, oh well, a good thing from the pandemic was, because for so many people there was nothing good at all. But I think the best way to honour the people who have suffered the most is to cling on to the things that we've done that have helped. And the thing that resonates with me so much is it has exacerbated existing inequalities.
Yes.
I am one of the fortunate ones. I haven't lost anybody close to me from the pandemic. I've been able to work from home. I don't have children. I am not someone who was on a 0 hours contract and then suddenly had 3 children at home to try and homeschool while you were trying to find another role, which was an impact other than just the direct public health impact, that it may lead on to more mental health problems, presumably, as we all come through that. I mean, that's something I'm a little bit fascinated by. How do you perceive when as the pandemic comes down and lockdown goes like this? What do you think the public health implications of that are going to be, both mental and physical? Have you got a thought in your head?
I think it's quite unprecedented to have been through a crisis that's, I said in some of my things I've written and said that if you said what would we have known a year ago, the impact on our lives of this crisis, I think we could only have imagined anything so dramatic if it was like a world war, couldn't we? Yes. That would have been the sort of thing we'd said, well, we'll all be at home for a year, we're all nonsense, that can only happen in. So it's unprecedented, and therefore I wouldn't quickly say it'll be like this, it'll be like that. I think there'll be a lot of exhaustion, there'll be some pride at the best behaviours people showed of solidarity and community support. There'll be anger at things that people think should have been prepared and weren't, or unfairnesses in the system, whether they're real or perceived. There'll be some lessons about, well, what do we want going forward that would protect us from this. There'll be a lot of people who have just been severely stressed. I think a lot of health workers and other workers who've been frontline, significant amounts of post-traumatic stress one's hearing about in the health service. There'll be the fallout of the economic fallout. And again, that's huge too. There'll be people who, the furlough might have supported them, or they might have just been using up their savings, and then they'll just be in a some industries will take, some industries like retail, well, maybe they'll never fully get back where they were. Others like entertainment, well, maybe they will, but a lot of companies and hospitality, but a lot of companies will perhaps go and have to be replaced over time. So there'll be such a wide range of fallouts, and then just look at something like things like close to me, like smoking and drugs. I don't know what the changes will be. Exercise and obesity. I think some people have discovered walking and the countryside near them and have been quite active, and others who probably don't live in the best conditions and are in, isolated, may have spent a year just sitting at home, hardly getting out at all because they're shielding or because they haven't got a nice environment to go out into. And so you'll see, I think what you'll see definitely is a lot of different experiences, and hard to summate and say this is the experience. It won't be, will it? It'll be, all of us will have slightly different experiences. And then children, what will be the impact on children? We've lost a year of socializing in school, and in some cases that might be fine, and some children can be quite resilient and get back to normality quickly, and other people may have really struggled and be set back a lot. And again, probably those with the most resources will have had the best education through this compared to people with less. And I fear it's another, I see this as a bit of a sledgehammer, this pandemic, just smashing into all the inequalities and generally making them all worse, unfortunately. So I'm giving slightly rambling answers, but I don't think there's an answer to that question either. It's another biggie.
It is. I think you're right, and I think people look at their own. There was a thing came up on my Facebook feed, and it was a photo of a Christmas market a couple of years ago, and it was one of the iconic ones with the Christmas market being absolutely ram-packed full of people. Yes. And my not commenting about the rights and wrongs of the market, but something in me was that I cannot imagine being standing.
It's horrifying to look at that now.
It is. Yeah. It is that number of people. I'm so looking forward to seeing some close friends and giving them a hug when I'm able to. But being trapped with a whole group of people is something that I struggle to get.
It might be really long term.
Small thing, but it may be a long term. It may be a long term thing that we all, no matter what we end up saying people can do, I think people's confidence will take a while to return.
And some people. It was interesting because I get certain amount. I'm sure you do. We get certain amounts of public feedback and public letters, and you get everything from those people who don't want any restriction and feel fine and just want to go about their business, and why is the state telling me what to do? And then you get other people who kind of have been taken the message so strongly. Often older people were terrified even to look out of a window. And you're saying it's all right. You can do what we can say. You can go to your shops if you protect, and you can use this, and it's wide divergence. But I think what's interesting, and for me again unpredictable, is how quickly our behaviours will and how much they'll go back. And will I, like you, will it take me 10 years before I really feel like I want to be in a big crowd, or will it all go in, once we've got the vaccine and it seems to be working, will we all get back to, I've worked in strange places in my career. I did my medical relief work, and one of the things that I noticed was working in the most extraordinary situations, it quite quickly becomes your normality. You kind of quite quickly assimilate a lot of things and think, oh, well, that's just how it is now. So we'll see. Yeah.
And also we quite quickly forget. I've got quite a lot of younger friends who were quite panicky almost at the beginning of this, and the closest I could bring it to was sort of the depths of the 70s, when you're on 3-day weeks and you had power cuts and bodies were piled up in the mortuary. I'm older than I look, Bruce, you're allowed to say that. And I kind of said at the time you almost felt like you're never going to get through it. And then within a year you'd sort of forgotten. My hope is that we don't forget the good bits. We don't forget the looking at nature, going for a walk in the park. We don't forget all that stuff. And for you, I guess, what next? If you're coming up to retirement, have you got a great plan that you'd like to share with us?
My great plan was to do a lot of travelling, which I think is a bit on ice at the moment. No, I apart from that, no. I mean, I was, as I said at the beginning, I'd hope to sort of do some planning. I'll do some voluntary work. I might do some studying. I might do some writing, or lots of reading. And like you say, actually, I mean, I always have enjoyed, walking and running in nature. So that would be part of it. But it's I need to kind of start thinking about that now, because I can see that after about 40 years of being entirely focused on job and family, it's a curious thing, because now I can do anything I want, but do I know what I want to do after having not really given it much thought for all of my life, except, well, I do this and I do that. So it's a slightly dangerous time. My wife's a couple of years older, so she can help me through the adjustment process, but certainly keeping busy is important. I think if you stop doing that, you know, you can easily get very depressed and feel very pointless. So it is keeping. I'm a trustee of a small charity in Oxford. I have been for many years, and that's one thing that I'll keep going. But I think I'll look for more. I think I'll look for some local things to be involved in. Right. And actually, having been a kind of a bit of a backroom boy for many years, something maybe more immediate. So the sort of thought I have is just mentoring, you know, young people who need a bit of support, rather than probably less being on grand boards and committees. I might prefer to do something a little bit more immediate in the future, but I don't know. I'm going to give myself time to just sort of think about it without feeling the pressure of I've got to do something quickly, I've got to do this, I've got to do that. And I am getting a new motorcycle, touring motorcycle, so I should be doing some nice riding as my retirement present.
Oh, that's excellent. And it's interesting you say that about there is a difference. Someone said to me a long time ago, and you know how some words just stick in your head. I'd done something, I'd helped them in some way. I can't even remember now, to my shame. And they said, you know what, Manda, today you haven't changed the world, but you changed my world for me. And there is something quite nice about not just working in the big things where you know you're making a difference, but you don't actually directly see it, and doing a little thing. So I think it is my absolute honour on behalf of the City of Bath, Bruce, to say to you and to your team, we cannot thank you enough for what you've done for the city over the last year. And in fact, in the run up to it, without you and your team, as you say, working with people and forming these places where people can go for one thing and end up actually having their isolation dealt with as well as their food needs, has been an amazing achievement. And you should all feel as proud of yourselves as we are of you. So can I, from the City of Bath, say thank you so very, 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 very much for what must have been a quite tough year.
Oh, that's so kind, and that's a great honour to that coming from you. So I thank you, and on behalf of my team who have really earned that praise, and thank you again. Yeah.
Thank you.
Okay.